Welcome to our Mental Health Roundtable. Obviously, it's Mental Health Awareness Week, so I'm really pleased to be joined today by Emma McDonald and Carolyn Brown. Carolyn is Walking with the Wounded's clinical lead, and Emma is a Head Start therapist on Walking with the Wounded's mental health program. So thank you both so much for joining us today to discuss how people can look after their mental health and learn some of the lessons from the past year. We were just joking, weren't we, that it's stressful just trying to get one of these things organised with garden streamers in the background and Facebook logins, etc. But I'm hoping you can calm my nerves over the course of the next 30 minutes.
No pressure there.
So first up, Carolyn, you've worked at Walking the Wounded for a couple of years, and maybe you can tell us a bit about your background and what inspired you to join the charity.
Yeah, lots of different things influenced my decision to work in the military charity sector. The main motivator was the fact that although I've never actually been in the military myself, I've always been part of that military community. I had strong role models who all served in the services, and I've always had a lot of respect for anybody who has served. So before coming to Walking with the Wounded, I had been a community nurse, a community mental health nurse, working with ex-servicemen and women. And so when the opportunity came to join Walking with the Wounded, I didn't hesitate. I'd always had a lot of respect for the Walking with the Wounded as a charity. So yeah, I jumped at the chance. My colleagues that I work with are inspiring. They're so passionate and proud of what they do. And my own program, our mental health program, Head Start, it's only a small team, a core team of 3, but I feel really working alongside them.
Fantastic, and we're lucky to have Emma with us as one of the Head Start brigade. Emma, can you tell us a bit about what you do and what the program entails, please?
Yeah, absolutely. So as you say, my name's Emma McDonald, and I joined back in 2017. So some years I've been with the program now, and I very much enjoy it. So my role is a mental health therapist. So I provide evidence-based treatments. So I do CBT and EMDR, and I provide that to veterans experiencing low mood, anxiety, trauma, and lots of other difficulties as well, challenges that we might face after the kind of traumas that we might have experienced. So yeah, it's something I really enjoy and proud to be a part of. Like Carolyn there, I have strong military links in my family and positive role models, and again, a lot of respect for our servicemen and women as well. So thank you for having me for all these years.
Oh, pleasure. And you brilliantly took part in our Twitter takeovers last year, focusing some of the questions, fielding questions about mental health, which was really successful, and I feel we'll be doing some more of those going forwards. Looking back over the past year, so since the start of the pandemic, how have you found that the challenges that people face with their mental health have changed?
Absolutely. I think more towards the start of the pandemic, I've seen a lot of anxiety related to the uncertainty of not knowing exactly, what is going on and what are the restrictions and what can we do, what can we not do. So lots of uncertainty there. And also in regards to employment as well, a lot of uncertainty there. But as the kind of pandemic progressed and we entered lockdown 2 and 3, I found people presented a lot more with things like depression. So the loss of social interaction, I think the lack of physical activity, getting out, getting to the gym, it all started to really have an impact, which is understandable.
Yeah, absolutely. Is it the same for you, Karen?
Yeah, I think it depends. It depends on whether there's been any pre-existing mental health difficulties, social economic situations, that kind of thing. I agree with what Emma has said, basically. Restrictions are easing, and with the success of the vaccination programme, there is a sense of hope and positivity. But for those with mental health problems, the past year has caused some of our veterans to take a step back in their own recovery. They've lost their support networks. Support may not have been so easily accessible. Loneliness and isolation has been a bit of an issue. And of course, there's been an increase in alcohol consumption, which is going to have an impact as well. So yeah, it's there's definitely been some changes in the trend, you know, from the start of the pandemic to what it is now. Yeah, and I think also the fear of returning to some kind of normal, whatever that might be, it's probably causing a lot of anxiety as well. But on a positive note, within the Head Start programme itself, our veterans generally move through the whole process of attending therapy sessions more swiftly. Sessions have been online and attendance has been consistent. But we do respect the fact that a small percentage of our veterans actually didn't wish to engage online at all, for various reasons. So, you know, we've gone with that. And for them, their treatment's been on hold. But hopefully, you know, over the coming weeks, we're sort of coming to an end, and we can start thinking about arranging for them to re-engage with their therapists.
Super. And what are the unique challenges that the veterans face, that those who served face over this period?
Well, I would say, I mean, the mental health difficulties experienced by veterans are the same as the general public, the general population, but the fact that because of their experiences during their military service and then the transition to Civvy Street, I mean, it could mean a deterioration in their mental health could be triggered by different factors. The difficulty in making the transition into Civvy Street, loss of support networks, housing can be a bit of an issue, homelessness, common mental health disorders such as depression, anxiety, substance abuse. I mean, they're the most frequently reported. And veterans who've been in combat roles, not always, but often more likely than those who haven't, to report symptoms of, you know, indicative of PTSD.
I suppose the important thing to emphasise, though, of course, this is the minority, those who serve them. The majority of transition fine and are doing very well.
Absolutely, yeah.
For those who are finding difficulty or who are living with somebody who's maybe in need of some support, what advice do you give to manage the transition as we come out of lockdown? You mentioned a fear of returning to normal.
Well, for me, I mean, I would say take your time if possible. Move forward at your own pace, whatever's comfortable for you. Talk to work colleagues, friends, family. If you are having difficulties sort of transitioning, just keep talking. Would you agree, Emma?
Yeah, I agree. I think you've made some great points there, Carolyn. I think, yeah, particularly pacing yourself. So don't be led by other people's pace. I think, you know, go at your own pace, some slow graded exposure to situations that you might not have been in for a long time. And be kind to yourself, be compassionate. It's going to take time, and situations you might have handled really easily before suddenly might be harder. So take it easy, take it slow. And I think take a bit of time out to think about what's important to you, your values. You know, where do you want to see your life, and what kind of goals do you want to set yourself? Don't go too big and put the pressure on, but where do you want to be kind of going forward?
Yes, that's a very good point.
Yeah,
especially about the goal setting and breaking things into small chunks and having something to aim at must be key, and tying that in with physical exercise.
Yeah, but it's also perfectly normal, isn't it, to feel anxious and unsure about, you know, what's about, you know, the whole situation.
Yeah, definitely. We know uncertainty in psychology. We know uncertainty plays a big role in triggering anxiety, and it really is just about taking your time with it and knowing that it will get easier. So the more times you go back into situations that you've not been in for a long time, the more that you will start to get used to those situations, and the anxiety will start to ease. But yeah, important, take it at your own pace and take it from there.
Great, good words of advice, thank you. And for those who might need some help and want to seek help or ask on behalf of others, how do they best access support? Carolyn?
If you're struggling, you know, talk to somebody. I would suggest talk to somebody you trust in the first instance. A good starting point is your GP. You can self-refer to the NHS Transition Intervention Liaison Service. The Veterans Mental Health and Wellbeing Service is now called Courage, and it is accessible to all veterans and their families, and the reservists as well. And we're going to be putting the contact details onto our social media during the course of the week. There's also the Veterans Gateway, that has links to various military charities and NHS services. So that's a really good resource. And it will give information about resources available in England, Scotland, Wales and Northern Ireland. So I would, I'd recommend going onto that website.
Great, thank you. I think that's the important thing, is wherever you are, you can find assistance. And Carolyn, you're based in Norfolk, and Emma, as you flagged earlier, from the accent, West Midlands.
Absolutely, yeah. And I think Carolyn's outlined some important ways to access support. And I think in the interim as well, if there is a wait to access support, you've also got things like Shout on 85258. It's a 24/7 text line that's anonymous as well, so you don't have to give a name. I think you support it. It's certainly there. And headfit.org, brilliant website for veterans, some straightforward skills that you can use if you're in distress, just to quickly bring down that distress. So yeah, please do visit those sites and get support. You deserve that.
Great, thank you. That's super helpful. We've got a couple of questions in. What do you get asked the most?
That's a good question. Okay, what do I get asked the most? I think it's that, am I okay to seek therapy? And is this common as well? I think so many people feel like they're alone and that they're the only person out there that's struggling. But I always say, remember that you're not. We openly don't talk enough about mental health. I think we should, and we should more, but remembering that you're not alone, and it's okay to seek support. We would if you had a physical injury, and this is no different. It's just as important.
Good stuff. Anything spring to mind there, Carolyn?
I was just thinking, there is a reluctance amongst veterans to talk about their mental health problems. Shame and embarrassment's always been a barrier to seeking help and support. I think it's one of the questions that's asked me quite frequently, or it's not a question so much as a statement, the belief that perhaps mental health professionals need to be ex-military in order to be effective or to understand. Well, the majority of our Head Start therapists aren't ex-military. Many are, and many have a strong interest in, veterans, the military. But I think Emma would agree, I don't think that it's necessary to be ex-military to be able to help a veteran, on his or her journey through to, through treatment.
Definitely,
yeah. That's a good point about not being a barrier. You are expert professionals at the end of the day.
Absolutely. And
we're talking about people. It's men and women. Live and breathe.
Definitely. And just to add to that, Andy, I always say to people as well, because I think Carolyn's right, that is brought up a lot. And I understand why, I really do. And what we have to remember is I might be seeing a number of different people that have been through different assaults, or I treat frontline police officers and things as well. And I haven't gone through those experiences, but I have the skills to be able to share, to help people. And we listen as well. So, if there's anything I'm ever unsure of, or I want to understand that environment, I will always ask more. So yeah, we'll always listen and try our best to understand.
Great, thank you. One more. So, what do you do to improve your own mental health? Quite personal.
That's okay. That's no problem.
What do the experts do? Do you practice what you preach?
Yes, I do. Not always successfully. I'm going to be fallible and hold my hands up there. So I like yoga. I love walking as well. So Cardinal Valley is one of my favourite places to go. I love kind of hiking up there and paddling in the river. So yeah, I just think getting out, being in nature, physical exercise is the way that just kind of helps me. So lockdown's been hard. So I absolutely share anyone. And I think veterans have struggled with that lack of physical exercise, getting out there, and that being restricted. So I think, yeah, let's go out and enjoy the world again.
Yeah, definitely agree with that. I mean, it's the theme of this year's Mental Health Awareness Week, nature. And I think if there's one thing that appears to have helped us during the 3 lockdowns, it's being able to connect with nature and the outdoors. That's how I manage my mental health, and yoga as well. I've tried a bit of mindfulness. It's helpful. Yeah.
Good stuff. And on the theme of nature and getting outside, I believe your grandson's engaged with the Captain Tom Challenge, getting out fundraising and getting active.
He has. He's done brilliantly. Yes. Yes. Theo.
Fantastic. And I guess that, there's lots of these platforms that you can engage in and use as triggers for, be it for Walking with the Wounded or anybody else, any range of causes, which can provide the goals and the stimulus as you stated earlier on.
Yes. Yes.
Good stuff. Well, yeah, same applies for me as well. I'm going to get out and do a bit more running. Who am I going to challenge on the 5K May? That's what I need to work out. Who are my 5 people I'm going to tag to inspire? Great. Well, thank you very much, Emma, and thank you, Karen, for joining us. I think we'll leave it there. Just any final thoughts on that you wanted to share about anybody who's been watching and listening, and possible next steps for them?
If anybody has any questions, they can message, can't they? By Facebook, the Facebook page.
Yep. Yeah, they come in talking to you.
Yeah, if they've got any questions or they want, any contact from any of us, then we can do that.
Great.
Absolutely. And just to kind of add on to what Carolyn said there as well, just remember that we're here for you, and that there's no shame in reaching out. There's no judgment. We're just 2 human beings sitting, hopefully face to face in a room together, but if not via video or telephone call, and that you are as deserving as anyone else of support. So please do reach out. We know not enough people in the research reach out, and it takes them years. Please just don't keep suffering.
Yes.
We're here.
Agree with that completely, Emma. It takes about 12 years is the average length of time, and that's just too long, isn't it?
Far too long.
Far too long. And now clearly a key point of Head Start is it's all delivered in collaboration with the NHS as well. So it's your GP is should be your first point of contact with
Yes.
but you're getting some amazing timings as well in terms of the turnaround time for arranging.
That's right. Yes. Yes. Very speedy.
Very speedy. Great. Well, I hope people are in touch. Thank you. If you're watching, hopefully you found it interesting. Do leave any comments below for Emma or Karen, and we'll get back to you. And take care of yourselves and have a super week.
Thank you, Andy.